Everyone, thank you so much for coming. This is awesome. It's like a party for my friends. I really appreciate you all being here. I'm Dr. Becky Lynn. I'm an OBGYN and I specialize in menopause and sexual health, sexual problems in women. And as of February, I will be opening my own practice. It'll be at in Chesterfield. I'm going to be a very happy person. And I will really have time to spend with my patients so I can really get to the bottom of their conditions and treat them appropriately. So I am going to tell you a little bit about me. So I'm a board certified gynecologist. I went to medical school at Georgetown University in Washington, D.C., and I did my residency here in St. Louis at Washington University. I've been an academic physician for the last 10 years, working in the university system. And I just have to point out that I'm not a big fan of Gwyneth Paltrow. Because she does some crazy things on her website and recommends some crazy things for the vagina. I do not recommend steaming. Don't do it. No scientific evidence, so I'm not a fan of her. I am
what about the egg?
Yeah, no jade eggs. That's bad. I'm a national and international speaker on topics of menopause and sexuality. I'm on the board of directors of ISWISH, which is the International Society for the Study of Women's Sexual Health. I'm also a NAMS certified menopause provider. So NAMS is the North American Menopause Society, and they have a special, it's kind of a hard test. I don't know if anybody out there has ever taken it. It's very broad. It's a difficult test. I passed, so I am now a certified menopause provider. I'm also a certified sexual counselor, and I just graduated with my master's in business administration. Never. I cover labor and delivery too, but that's all ending soon. So I'm going to talk about menopause, some of the common symptoms of menopause, and some of the things that you'll see not related to sex. And then I'm going to turn it over to the sex part, the sexual problems that menopausal women will encounter, and we'll talk about all of it. All right, so everybody knows that people get hot flashes and night sweats when they go through menopause. These are miserable. If you've been there, you know. You wake up drenched, you're sweating. One of the common things that I see is women start sweating in their groins. If you've been there, you know it. So you're walking around and it looks like you wet yourself because you're so sweaty and it's miserable. Night sweats, they'll wake you up at night. You toss the covers off. You have to change your sheets. It affects the next day because you don't sleep very well. And you're not doing anything good for climate change because you're constantly running the air conditioning. And there's a little hole in the ozone layer above your bed.
Becky, can I ask you one thing?
Yeah.
Are you going to be doing a Q&A later?
Yes.
Okay.
Yeah. So I can take questions now or I can take questions later. So, there's so many women out there who want to know, well, what can I do about these hot flashes? Do I have to just live through them? And the answer is definitely no. There's some behavioral changes you can do. Dress in layers, bring a fan. I tell my patients to chew on ice. I'm sure the dentists out there are just cringing because I don't think it's good for your teeth, but it really works because it cools your core. Avoid things that bring on your hot flashes like hot drinks or alcohol, coffee, things like that. If that's not doing it, I know, all the things that are fun, alcohol. You guys are cracking me up. The gold standard treatment for hot flashes are hormones, and we all hear the word hormones and we're like scared half to death because if you read the package insert, you think you're going to die. But I will get to it. Hormones are not all bad, and hormones actually have many protective effects if started in the right patients at the right time. And then there's SSRIs, which are selective serotonin reuptake inhibitors. These are things like Paxil and SSRI. They're antidepressants, but they actually work for hot flashes as well. So for women who can't use hormones for whatever reason, clotting disorder, breast cancer, you can also use some of the SSRIs. Or there's another group of antidepressants called SNRIs. And these are things like Effexor. They're antidepressants as well, but they work slightly differently. And they do a fairly good job, but really the reason women have hot flashes is because their ovaries aren't making that estrogen anymore. So if you give them the estrogen back, that will fix the hot flashes. Okay, fun fact. After menopause, women will start to deposit fat around their middle instead of their hips and their bust. So that's not fair. That's really unexciting. And I see a lot of women who come in and they're like, I don't know what's wrong with me. I'm so bloated, or I have a belly now. And it's because you have so much less estrogen, and estrogen tells your body where to deposit fat. So what can you do when you gain weight during menopause? The other thing that happens during menopause is your metabolism slows down, and you just start to gain weight in general. So, you know, a lot of people will come in and be like, I eat just fine, you know, I eat just fine. Why am I gaining weight? Well, losing weight is definitely two-pronged. It's a combination of caloric restriction and aerobic exercise. So we all probably eat more than we think we eat. So it's a good idea to keep a journal and write down what you eat, because I don't know, every time I do that, I'm like, whoa, that's a lot more than I thought I was eating. But you also have to exercise. And by aerobic exercise, I mean getting your heart rate up, breaking a sweat, because that's a calorie burner. And so many women will say, well, I go to the gym, I run, 3 miles 3 times a week. And so what I tell them is that the first time you ran 3 miles, you weren't in shape. And so you probably burned a lot of calories because you weren't very efficient at running those 3 miles. And so what you have to do in order to burn more calories, because eventually you get good at it, you burn less calories, you have to go longer, you have to go harder, or you have to pick a new sport and learn that one all over again and struggle through that. So exercise is great, but you also have to really challenge your system in order to burn a lot of calories. The other thing that you can do to help speed up your metabolism is weight training, because muscle burns more calories than fat. A lot of people are super busy. They don't have time to go to the gym and run 6 miles and then spend 3 hours lifting weights. So in my opinion, if you have limited time, if you work, if you're busy, I would focus on the aerobic training because it speeds up your metabolism stays faster even once you're done exercising. So I'm a big runner. I know there's a lot of runners here. I love running. I could probably go a little faster and burn more calories, but I don't. I'm the caboose. So anyway, what about anxiety and depression? So this is another really common symptom of menopause, more common than you would think. And actually, Tasman told me it was on NPR this morning, this depression, anxiety, and the perimenopause. So there are a couple of things that contribute to depression and anxiety. So getting older. I don't know, I don't like getting older. I'm not so happy about getting older. But your sense of self changes as now you're an older woman instead of a younger woman, and that really kind of affects your identity. Many around the time of menopause, many women will have their children leave. They go to college, they leave the house, and for like 20 years or 18 years, that was your identity. You're somebody's mom. You drove them to activities, you took them all over. All of a sudden they're gone. You're now like, who am I? And you feel sad or depressed about that. It's a big deal. As you get older, you face chronic illnesses. So now maybe you've developed diabetes or hypertension. You have to take medicines every day. And so you're just not feeling so good about yourself anymore. About this time, you have some financial stressors, college education, and maybe you're that sandwich generation where your parents are ill and you're taking care of them. You're dealing with financial stressors, and then your kids are leaving and you're an empty nester, and you're not feeling so happy. So depression is a really common thing, and it's very important to treat, but also easy to treat. And one thing I always mention to my patients is exercise treats depression. So exercise is like the answer to everything. Your weight gain, your moods. I mean, exercise is key. So it does so many beneficial things besides helps prevent diabetes and keeps your heart in check and keep, good heart health. There's just so many reasons to exercise, and it's one of the cheapest things you can do, the freest things you can do for depression and mood disorders. Okay, so we talked about exercise. One thing I left out is counseling. A lot of people feel funny about going to counseling. They don't want to talk about their problems, or they feel that when they go to counseling, they're not getting anything out of it. And so one thing I've realized with my patients, I send them to counseling often. And counseling is set up different from a doctor's visit. So when you come see me, you tell me your problems, I tell you how we're going to fix them. But counseling, a lot of times you need several visits before the counselor is going to tell you how to fix the problem. They want to go in detail into your family history, what were you taught by your parents, and so my patients get very frustrated because they say, I went 3 times and she didn't help me or he didn't help me because all they did was ask me about my childhood. So I usually say stick with it. You'll eventually get to the point where they can actually help you, but they do go in depth. Okay, this is really scary to a lot of menopausal women. So short-term memory loss, it is a real thing. Okay. So you might have been that person who could remember everybody's phone number, and all of a sudden you can't even remember what something's called, right? All of a sudden you forget your nouns, you only know adjectives. It's that thing that's green, it's that tall, like you just, right? I mean, I totally get this. Those word finding difficulties, it could be pretty scary because we all worry about things like Alzheimer's and dementia, but word finding difficulties are super common around the time of menopause. And then night sweats. If you get no sleep, you're in brain fog the next day. You can't function, your brain isn't as sharp as when you're well rested. Hence, I'm not going to do labor and delivery anymore. And I'm so happy. So how do you treat that? What can you do? So the answer is, like everything, exercise. And by this I don't mean aerobic exercise. I mean like exercise your brain. So this is like things like, remember that Simon where it was the colors blue, blue, green, and it made little noises and you had to it was like a game of memory. All of that, like using your brain, has been shown to improve this short-term memory loss. So it's like a use it or lose it kind of thing. You can learn a new language, you can do Sudoku, any sort of crossword puzzles, anything that challenges your brain is really good to keep it in shape. And also regular exercise, like aerobic exercise, decreases the progression of Parkinson's disease, decreases the chance of you getting Alzheimer's. So one more reason you should all exercise. So what about hormones? So our thoughts on hormones have changed with time. So in the 1990s, everybody got put on hormones till the day they died. You were 101, you got your Prempro. And then there was a set of research, many research projects that were done looking at if giving somebody hormones can prevent heart disease. Because there were some retrospective studies looking backwards that said, hey, people who take hormones, they have less heart disease. But what we really needed was a prospective trial, which means looking forward, a placebo group, a hormone group, and watch them over the next several years and see if the people on hormones had less heart disease. So they did this trial called the WHI, or the Women's Health Initiative, and they were hoping to find that hormones decrease your risk of heart disease, but that's not what they found. So what they found, this was back in 2002, they found that women on Prempro, which is one specific type of hormones, had an increased risk of blood clot, breast cancer, heart attack, and stroke. So they're like, what? Increased risk of heart attack? What's going on here? We didn't think that. And a decreased risk of colon cancer and a decreased risk of osteoporosis or hip fracture. Women in the estrogen-only group, so those people who had a hysterectomy, they only had an increased risk of stroke, but not an increased risk of breast cancer. In fact, it was decreased, but it wasn't statistically significant. So you can't say, well, that was just, it might have been just chance, but it was certainly not increased. And so because of these findings, they stopped the trial early. It was all over the news media. If any of you were around in 2002, when I was a resident, like people were calling the office, should I stop? Is this dangerous? Everybody came off of it. But they followed these women out throughout the years, and they reevaluated the data based on age ranges. So when they looked at the information in the Women's Health Initiative, and they broke it down into women 50 to 59, 60 to 69, 70 to 79, they actually found that women in that 59 age group did have a decreased risk for heart disease, a decreased risk for dying or overall mortality, and no increased risk for stroke. But did the media pick that up? Not really. It wasn't all over the news. It kind of got glossed over. So since then, people are so afraid of being on hormones, even though there's a benefit to being on hormones if you start them at age 59 or less. Well, let me back up. Let me go back here. So when I talk about hormones, I'm talking about estrogen and progesterone. That's hormone replacement. I'll also talk a little bit about testosterone, which is sort of a off-label use. It's not FDA approved for women. So why would you take hormones? You would take hormones if you're having hot flashes and night sweats. That's what they're indicated for, estrogen and progesterone if you have a uterus, estrogen only if you don't. But they also keep your bones strong. They also prevent aging because they moisturize your skin. So they're really good for your skin. Many women, they go through menopause, they have joint aches. You give them hormone therapy, they feel better. And it definitely helps with brain fog in that 50 to 59 age group. So there's a lot of benefits to hormones in the right person. Okay, so this is just, like I said, if you start them 59 or less, decreased risk of heart disease, decreased risk of dying, no increased risk of stroke, so definitely benefit. But what about breast cancer? That's what every woman is afraid of, breast cancer. So in the WHI, there was an increased risk of breast cancer in women on hormones, and they were on estrogen and progesterone in the form of Premarin and Provera. But Premarin and Provera are hormones that are made in a lab. They are not bioidentical. And what I mean by bioidentical is I mean that those are the same hormones that your own ovaries make. I do not mean compounded hormones, although people use that like in the, on the internet as the same thing. You can have a compounded synthetic hormone, but bioidentical means it's just what your own ovaries would be making. So prometrium is a bioidentical progesterone. And there's actually some scientific data, some research studies that show that prometrium does not increase your risk of breast cancer within the first 5 years of using it, maybe 7. So I never give anybody Provera. If I'm going to give them hormones, I'll always use prometrium or a micronized progesterone, which is bioidentical. But there's nothing without risk, right? Like every medicine you give somebody will have a side effect and it'll have risks. Okay, so that's kind of summing up the main things with menopause. I'm going to turn over to our most popular topic now, sex, because even though we don't talk about it, many of you are doing it, and a lot of times we don't always know what's normal, what's not normal, or what's going to happen to our sex life during menopause. So the first thing I'm going to talk about is painful sex, and I would say that menopausal painful sex probably makes up about 30% of my practice. So what happens to the vagina when you go through menopause? When you go through menopause, you lose your estrogen. So the vagina changes. So a premenopausal vagina is thick, the tissue's thick, it's moist, and it's got all these wrinkles so that it stretches, so that a baby can fit out of it and a penis can fit into it. When you go through menopause, the tissue changes. It becomes really thin and really dry, and it doesn't stretch. It loses those wrinkles, those rugae. So I always like to say the vagina is the only organ that I know that gets less wrinkled as we age. Poor Susie has heard me tell that joke like a zillion times, but I think it's fun. All right, so what can you do about vaginal dryness? There are plenty of things you can do to treat vaginal dryness. You can use lubricants and moisturizers. So lubricants come in a variety of flavors. There's water-based lubricants, there's silicone-based lubricants, and then you can also use things like olive oil in your kitchen. So if you're postmenopausal and you're not using condoms, you don't want to use a water-based lube. So most people go to Walgreens, CVS, and they see water, and they think natural and healthy. And then they see silicone, and they think chemicals, bad, but not the case. Water-based lubes pull moisture out of the vagina. If you are a younger person with loads of estrogen, no big deal. But if you're postmenopausal and things are already dry, then you don't want to use a water-based lube. You want to use a silicone-based lube or olive oil or coconut oil or Crisco or any of those.
Becky, couldn't you use the water-based lube as just a moisturizer for vaginal dryness?
No.
No?
No, because it's drying. It's very, very drying. It pulls moisture out. There's some good scientific studies that show that it does that.
Okay.
Yeah. So if you want to use something for moisture, then I would choose silicone-based or something like Crisco or coconut oil. I can give you those studies if you want.
Yeah. Crisco, not coconut.
Yeah. So, now all of those lubricants and moisturizers do a great job at moisturizing, at decreasing friction, but they don't give you the stretchiness back. So premenopausally, you have collagen and elastin, allows for stretchiness. When you go through menopause, that goes away and the vagina doesn't stretch, and that hurts. And when you don't have the hormones there, you lose blood flow to the vagina. So even if sex doesn't hurt, you might be like, nah, I don't really feel anything. And if you don't have blood flow to the vagina, you don't have nerve growth to the vagina. So the only way to sort of bring the fountain of youth to the vagina is with vaginal hormones. And there's a variety of ways you can get vaginal hormones. There's intrarosa, which is a DHEA, which is like a brother and sister to estrogen. It gets converted to estrogen and testosterone in the vagina. And there's actually, the vagina needs testosterone to make moisture. There's Imvexi, which is just estrogen that you can put in the vagina, and there's creams that you can put in the vagina. There's a variety of other things, but I don't think they work very well, and they're like super, super low dose, and they just don't do anything. They're like a raindrop in the ocean. So, and also if you use vaginal hormones, you bring blood flow, you bring nerve growth. It helps with orgasm, because when you lose the hormones, also the clitoris needs hormones, so here's what my menopausal patients tell me about orgasm when they go through menopause. They say, it takes so long to get there, it's so much work, and when I get there, it's like, meh, whatever. So, and that leads to low libido, because then sex isn't really satisfying, and they're like, oh, it's not great, do you feel like having sex? No, not really. So it's really important to give the hormones back to the vagina. And one thing that's really important to know about this is vaginal hormones do not increase your risk for breast cancer, blood clot, heart attack, and stroke. That's so key, because women are afraid. They're so afraid of these hormones, and the low dose vaginal hormones don't do that. So what about vaginal laser? This is, if you've heard of vaginal rejuvenation and all of that. So there are a couple of lasers that have been studied to treat vaginal dryness due to menopause. So they're fractional CO2 lasers, which just means they do a little laser energy inside the vagina, outside on the vulva, and they work similarly to lasers that you use on the face. They break down old collagen, and then your body creates new collagen. So the thing to know about these lasers is they're not FDA approved for treating anything. They're FDA approved for use, but they're not FDA approved to treat something particularly, including vaginal dryness due to menopause. But there are published studies looking at if they actually work. And there are some small studies that show that they improve dryness, improve elasticity, decrease pain, and they also have been shown to help with incontinence. But the problem with the studies is they're very small, and there's no placebo. So, if you give somebody a treatment and they really want it to work, they're gonna tell you that it worked. So you really need the placebo-controlled trials, and those are coming soon. Well, not soon, they're coming in several years. But so where I see this is I think there's good potential for these, but you have to keep in mind that it's kind of it's an off-label use, although people are using them all over, and even in Chicago, Northwestern has a program for breast cancer survivors who don't want to use hormones, where you can get the Mona Lisa laser for free. So it's pretty awesome. I wish they have a donor who's got a lot of money, they told me. And I'm like, oh, where can I find a donor in St. Louis so I could do that? But we don't have one. So let's talk about sex drive. So low sex drive. Yeah, Ryan Gosling, he's my favorite. Such a cutie. So low sex drive is pretty much 40% of what I see in my practice every day. And you know, we've all been trained to think that sex drive should happen out of the blue, right? Everybody should just have spontaneous drive. And so many years ago, there was Masters and Johnson. I don't know if you know about these researchers. They happen to be in St. Louis at WashU, and they're really famous in the field of sexual medicine. But they actually, I think they ended up married. I think one left their spouse for the other one. They did all these experiments on sex, on themselves too. But they actually delineated how sex works. So they came up with the sexual response cycle, which they said starts with desire. So somebody just has desire, I just feel like having sex today. Then they become aroused, maybe there's genital engorgement. Then they hit like a plateau before they reach orgasm, and then there's a resolution. And they said that was true for both men and women. But women are a little bit more complicated than men are.
Pretty much.
So that didn't turn out to be quite true for women. Women have a little bit more convoluted sex drive. So there was a woman named Rosemary Basson. She's a psychiatrist in Canada, and she came up with this intimacy-based model of the female sexual response cycle. And what this says is that women, and this is not true for everybody, but women have a more responsive drive than an innate out-of-the-blue drive. So you may not be thinking about sex, but if your partner comes by and gives you a hug or a kiss or whatever it is that you need in a relationship, whether that's attention or he took out the trash, then it makes you feel a little bit more sexual. So many times a woman will come in and say, my spouse or my partner says, you never initiate. Why don't you initiate? Are you cheating on me? Do you not love me anymore? And the woman says, no, I love you. I just really just not thinking about sex. So for women, it's definitely a more responsive desire than innate, out of the blue, kind of spontaneous desire. And really, desire never happens in a box. Like things that are sexual, they're all interrelated. So if you're menopausal and you have painful sex, well, of course you're not going to have any sex drive. I just call that good judgment, right? If it hurts, don't do it. So if you are having pain, your libido goes down. Let's say you have low libido, and so you really didn't feel like having sex anyway, but you do, then you weren't aroused, so that causes dryness to be worse. And then you have pain, then you can't reach orgasm. It's just all interrelated. It's very hard to separate them out. So for women who have low sex drive, what happens is this thing called duty sex. Has anybody ever heard of duty sex? If you know Jim Simon, you've heard of duty sex. So duty sex is where, you know, your partner needs sex because men have a much higher drive than women. And it's a relationship, and you want your partner to be satisfied. And these are all generalizations. Not everybody fits this bill. But, you know, your husband needs it, so you do it because, you know, I like Indian food. My husband Patrick doesn't, but sometimes he goes to Indian food because I want it. So you make these compromises in relationships. But what happens is, in general, sometimes a woman will be like, okay, just thinking, just get it over with. We've all been there, right? Just get it over with. So, but then it's not satisfying sex. It's not good. They don't, you know, they'll be, the husband or the partner might say, well, you know, let's pleasure you. And the woman might say, don't worry about it. Don't worry about this. You can get me next time, right? But that just makes for unsatisfying sex. So then your libido, you think, oh, no, sex wasn't that great. I don't really feel like doing it. But if your pleasure is consistently taken care of and sex is good and you reach orgasm, well, the next time it comes around, you'll be like, yeah, I remember, that was good. Let's do that again. So the other thing that happens with orgasm is your brain releases dopamine, And dopamine is a neurotransmitter that's part of your reward system in your brain, and it makes you feel really good. So dopamine is the same thing that's released if you do cocaine, if you do heroin. You're like, whoa, that flood of enjoyment, let's go get some more. I do not recommend you do cocaine or heroin. Just go have an orgasm. That's a better way. That's a better way to do it. So basically, in order to have sex drive, you have to be having sex worth wanting. In order to want to have sex, it has to be sex worth wanting. And if it's not, then, like I said, it's just good judgment. Why waste your time? One more thing about drive is that in general, women sometimes, or at least in my practice, get in bed at night, they're tired. They've been working all day, they've got kids to take care of. They get in bed, they just want to be left alone. The last thing they want to do is have sex in general. And men in general use sex more than women to wind down. They get in bed, that orgasm for them is kind of calming, it helps them get to sleep. So, but women aren't all like that. They, a lot of times they're like 11 o'clock at night is not the best time to have sex. So what I recommend to my patients is scheduling sex. So don't wait till 11 o'clock at night on a Thursday night, make time for your partner, your spouse at, Saturday morning or Sunday afternoon. Put it on your calendar, get a babysitter. It does not make you a bad mother to leave your children so you and your spouse can get it on. That's really important to a relationship. But I think a lot of people feel guilty, especially when their kids are babies. I can't leave my baby. I'm a bad mom if I put him in daycare, if I, put him with the babysitter. But if you don't nurture your own relationship, you'll end up with relationship problems, and that'll fill over to the family and to your children. And your kids don't want to see you fight or hate each other. So sex is really, really important to a healthy relationship. All right, so that's the dopamine molecule for anybody who knows OCHEM. Okay, so I have about 13 steps that I recommend to my patients that are not medicines to improve your drive. And this is only 4 of them because I could talk for hours. I do have a blog on my website where I delineated 9 of them. So please go to my website, evorabyDrBeckyLynn.com, and read my blog because there are a lot of things you can do that will help improve your drive. So I sort of alluded to this, find a solution that works for both of you. Where can you meet in the middle? Many couples get into this road, okay, this is what we do when we have sex. We start here, we go here, we end here, done. And it becomes a little bit boring. So pick a new room, pick a different time of day, wear a wig. Did you always want to be a blonde? Like, now's your chance. Like, make it exciting, make it adventurous. And then make sure not to forget your partner, because especially in long-term relationships, your partner's going to be there, so they become your last priority, and then things start to separate. Don't let them be your last priority. So let's talk about the medicines that you can use to improve your drive. So if you're postmenopausal, testosterone replacement has been shown to improve everything related to sex drive, orgasm, arousal, dryness. Numerous scientific studies have shown that it works, but it's not FDA approved in women. And we can get into why that's the case, why there's 26 medicines for men and 2, 3 for women now. A lot of white men on the FDA board. I didn't say that. But there's definitely some issues with that. The first drug that they FDA approved for low libido in women was rejected several times. And it's been very difficult to get things through the FDA for women's sexual function. So it's not FDA approved, but it's used by so many providers, and there's a lot of scientific evidence to show that it works. There was just a paper written, which was sort of a consensus paper. It was written by experts in the field on how you can replace testosterone, who's a good candidate for testosterone, what things you have to follow and check. And what they said is that the goal is to put the testosterone in the normal premenopausal range, not in the male range, although you'll have excellent libido, but you'll also have a beard. So that's not a good thing.
I know, right?
And so this, I know, what can you do? So this consensus statement said you can really use it in a postmenopausal woman for low libido. But there is some data, although it's not as robust, that it helps with fatigue, it builds muscle mass, it improves your metabolism, it increases your muscle strength. So the recommendations by the experts are not to use that, to use testosterone in women for those things, but if you're using it for libido, it might have these other added benefits. But you don't want to use too much. So with that, I want to address BioT, which I don't believe in. So BioT are these pellets, testosterone pellets, estrogen pellets, and I actually did a medical literature search the other day because I hadn't in a while. There is no published research studies on these pellets. And I see patients come into my office with testosterone in the male range, basically male. And I had somebody the other day, she came in, she's like, my breasts are sagging and I've got facial hair, you can develop male pattern balding. And those are all risks of high testosterone. So, this is from their website, the bottom, and it's interesting. It says, these statements have not been evaluated by the Food and Drug Administration, and they're not intended to diagnose, they're not intended to treat anything, cure anything, or prevent any disease. So I tend to see the fallout from these testosterone pellets. And I think part of the problem is these women come in with male range testosterone and they're like, why isn't it working? Well, maybe your partner is really mean to you, or, is not a nice person and tells you you're fat and ugly. All the testosterone in the world is not going to make you want to have sex. So I'm not a big fan of these. They cause a lot of complications and side effects. So now I'm going to turn to non-hormonal treatments for low libido. This is a new one that was just FDA approved, Vyleesi, for low libido in premenopausal women. I've put several patients on it. Not everybody, but most people like how it makes them feel. It's an as-needed injection. So you just use it as needed, kind of like Viagra, but it's not Viagra. And so when you want to have drive, you inject it into your leg, and then it starts working in about an hour, but it can take several hours, and it can last up to 16 hours. Its main side effect is nausea. So everybody that I know, that's a mood killer,
Good
right?
sex and vomit.
Yeah. So we don't do the vomit thing.
Sex was great. I vomited all over him. Okay, sorry.
If that's your fetish. So I always give a Zofran with it, and I just tell my patients to take the Zofran because you do not want to get nauseated. That will just make your low libido worse. There's also Addyi, which has been out for a couple years. This is a pill that you take every night. Neither of these are hormonal. It works about 50% of the time. It takes about 6 to 8 weeks to see an effect. It was initially studied as an antidepressant, but was found to have positive sexual side effects. Neither of these are going to give you the sex drive of a 15-year-old boy. That's just not going to happen. But it makes you more receptive, more spontaneous sexual thoughts throughout the day, more interested. And patients will ask me, do I have to be on these forever? And the answer is no. Because once you get back in the swing of things and sex becomes good and you want to have sex again, you can try going off these, and then you're sort of back in shape for sexual activity. So I want to talk a little bit about my new practice. I'm leaving the university that I work for, St. Louis University. I'm starting my own practice for a variety of reasons. And I'm opening a direct care practice, or some people call it concierge. So what that means is that I'm not going to be taking insurance. It'll be either cash pay, you can use a health savings account, you can use your flexible spending account, or you can submit your visit to your insurance yourself for reimbursement. And there's actually an app to help you get reimbursed. But the reason I'm doing this is because I want more time with my patients. And right now, standard traditional medicine, you've all been there. You get 5 minutes with your patient, right? It's in and out. And if you have 2 things to discuss, you're only allowed to discuss one because insurance won't cover both. So you have to leave and come back and pay a copay and wait in the waiting room for 2 hours because your doctor's way overbooked. And what I noticed for me, it was making me not the best doctor that I could be. It takes me a long time to look at my labs. It takes me a long time to call people back because I'm seeing patients all day. I go home and I do charting all night. And it's just not quality. So what I really want for my patients is I will have time for my patients. They won't be waiting because I'm not gonna overbook myself. And they'll have my cell phone number. So if my patients have a problem, they call me directly. They don't have to call the triage nurse who says, I'm gonna get to the doctor, and then it takes 3 hours to get to the doctor, and they don't get an answer till the next day. My patients will have my cell phone number. I'm also gonna offer telehealth. So if you drive from far away, and I see plenty of patients who drive from Springfield, from Cape Girardeau, if we don't need to do an exam, then I can just see you with telehealth. And it saves you a whole day off work. The gas money that you spent driving here, it's just so convenient. So I'm offering that too. For people who live outside of Missouri where I don't have a license to practice medicine, I'm offering eHealth, and the E stands for education. So if you feel like you never learned about menopause, nobody ever talked to you about normal sexual function, I can do this too via kind of a Skype-like platform. And so my goal really is to educate women on what's normal, what's not normal, should you see your doctor or not. What I can't do is be your doctor. I can't prescribe you medicines via eHealth because I only have a license to practice in Missouri. But if you just have general questions about sexual function, then I am more than happy to answer them. So why direct care? You shouldn't have to wait for days for your doctor to call you back. And you deserve more than 5 minutes with your doctor, right? You deserve way more than that. And your doctor should have time for you. My resources should go to you, not to collecting from your insurance company. And your health, I sound like a commercial, but it kind of is. Your health is an investment, not an expense. So for now, I am offering a 10% discount to anybody who comes to see me, 10% off the initial consult. I also have a concierge, which is a membership fee, which makes your visits less expensive, and you get 10% off of other services. My concierge members who are part of the membership get 10% off the spa services at Vein Specialties, Med Spa. They do Botox, they do laser, they do all awesome things. If you do sign up with me, you just have to use the coupon code I am worth it, and that will automatically give you your 10% off. The best way to sign up to see me is on my website, which I should have up here and I don't, but it's Evora, E-V-O-R-A, by B-Y, Dr. just D-R, Becky Lynn, B-E-C-K-Y-L-Y-N-N. So Evora by DrBeckyLynn.com, and you can schedule with me that way. So thank you all for coming. This has been a lot of fun. I am more than happy to answer some questions, but I think first let's turn it over to Leanne, who is our skincare expert, and we all know that the menopausal women really want to know how to make their skin beautiful. So come on up.
So just a little bit, I'm not as prepared as Becky with the slideshow and everything, and I'm going to read from my phone.
Okay. Go ahead and read.
Beauty Counter is basically a company that was started 6 years ago. It was started by a woman, which is pretty awesome, and she saw the movie An Inconvenient Truth. And it just totally freaked her out that all these cleaning products and whatever else we use in our homes are filled with all these chemicals that are depleting our ozone layer and causing all these issues with the earth. And then she started cleaning out her closets and buying all these cleaner, greener brands, and they just weren't working. And she got this idea of, well, what about beauty products? So the same thing. So she started pulling out all the beauty products and reading out all the ingredients, and she was like just horrified. So the reason I got into it, honestly, was when I had my kids. I was like, they have virgin skin. I want them to be protected and use the best of anything that I can find for them. And the more I started even reading those ingredients, I was kind of a little horrified that these ingredients were not as good as they were chalked up to be. So the best thing I've been using to find out about ingredients in products, in any products for that matter, whether it be cleaning products, whether it be your tampons, whether it be your beauty products, anything that you're putting on your body or using in your house is EWG. So their list, of course, is not as extensive as it should be or can be, because there are just so many products out there. It's really super hard to keep up. But if you're not sure about an ingredient in a product, you can look it up under EWG and just put that ingredient in there, and it'll tell you the rating of that ingredient. So just to sort of step back a little, just to give you a little insight in why I am what I am and what I do. I was a personal trainer for how many years? I've kind of lost track of time.
Many years.
Since 1995, feels like forever. Group fitness trainer and a certified nutrition and health coach, and of course a better beauty advocate. So this company is based out of Santa Monica, and they work tirelessly to get better regulation in the industry, because right now there is very little regulation in the industry, and I know a lot of you know that. Especially you guys as well, right? So currently the USA only bans 30 questionable harmful chemicals. The EU 1,400. So the gap is pretty extensive and pretty scary that we are so far behind. The other thing that sort of made me do a really look around and turn around in everything was I got melanoma. I was super lucky. I just had to have 2 surgeries, that was it. So no chemo, no radiation, nothing. I was really lucky. So it really made me question everything. Sunscreens, beauty products, chemicals in our everyday cleaning products. So much like Greg, who started Beauty Counter, I started slowly changing everything out. It's a gradual thing. You can't just do it all at once. It's too overwhelming. But what I do want to just discuss a little bit with you, besides taking care of your skin, is really the chemicals. I'm going to sort of highlight just 2 or 3 of them, just so you understand. And Becky will actually, she'll probably be really good on this. I had a big blog, Instagram post the other day about phthalates and how they're a family of toxic chemicals that have been linked to allergies, asthma, infertility, reduced testosterone concentrations, and endocrine disruption. So, and it actually affects everybody across the board, some more than others. So fragrances, do any of you have an idea, can guess where we can find phthalates? Any of you? I just gave one away. Fragrances is one of them. Cosmetics and shampoos, soft toys for children's, pets that play, building and home decorating materials, and even children's clothing. So it's really kind of hard, but control what you can. So an estimate of 75 to 9% of cosmetics contain parabens, making them the most widely used preservative in makeup and skincare products. It has been linked to hormonal disruptions, breast cancer, increased skin aging, and DNA damage. Studies have detected parabens in nearly all urine samples taken from adults in the US, regardless of demographics. That's kind of concerning. The other one I want to talk about, just highlight a little bit, is DEA, which is diethanolamine. A hell of a mouthful. So really anything that is hard to sort of say, stay away from it. So this helps make cosmetics produce creamy or sudsy sort of textures. So anything that's soapy, you check it out and see if there's DEA in it, because that causes moderate skin and eye irritation with sustained exposure that has been linked to liver, skin, and thyroid cancers. So any guesses what we find this in? Any? Facial cleansers, shampoos, soaps, and moisturizers. So, if you have any questions about anything, just either you can, I'm sure Becky will know some of this stuff, because I'm sure you are faced with some of it in your practice. Mm-hmm. And then I'm happy to answer any questions as well. Your skin is your largest organ of your body, and it does take, some people say, no, if you put water on it, it doesn't go into your skin. That may be true. It's kind of, it lets a certain amount in. It's not going to let everything in, otherwise we'd drown while taking a shower. But it does let stuff in. I mean, think of patches you put on to stop smoking, or for
hormone patches.
or hormone patches, or even for diabetes. So yes, what you put on your skin does matter. So, you know, start off slowly. My biggest recommendation is sunscreen, for sure, if you want to stop anti-aging, if you want to protect from skin damage. Sunscreen every day. It doesn't matter whether it's winter or not. In winter, the sun's at its lowest. You actually do get more sun damage in winter than you do in summer. And I know summer we're spending more time outside. And then face cleanser, because that is literally the first thing you are putting on your skin, really. And I would suggest that if you are not one of those people that want to do skincare morning and night, the first thing you should do is at night, because you're going through a day of being outside, being through all these elements in all types of environments. Wash your face. Keep your skin clean. You're not going to get it that dirty unless you're getting up to mischief at night.
Unless you take my advice.
Then wash it. Anyway, so if you have any questions, I'm happy to answer them. I have a gift bag here that if you sign up, I have a sign up sheet there, so please sign up, and then I will do a little draw later on this evening or tomorrow morning, and I will email you and get it to you somehow. And other than that, does anyone have any questions?
I was actually just going to mention the EWG, they have an app that you can download
Yes.
on your phone, the
Yeah.
Healthy Living app, and you
Yes.
can scan products like
Yes.
at the grocery store.
Yeah, it's awesome.
Yeah,
so
it's
they
really
have one
helpful.
called Skin Deep, EWG
Mhm.
Skin Deep as well. So yeah.
Cool.
Yeah, so it's easy, download it. There are others, there are two others, but I don't really particularly like Think Dirty, because I don't think they do as an intensive research on their products as EWG does. So, and EWG sort of covers everything, even from herbicides, pesticides, anything. So,
All right.
all right, thank you.
Thank you. So be sure to visit take a look at all the products here.
Oh, yeah.
Leanne's stuff is
Lots of
great.
beautiful
I
stuff.
use Beauty Counter. I love their face wash. It's not very harsh, so I like that for dry skin. So be sure to visit, but I'm happy to take any questions on sex and menopause.
I have a question.
Oh, okay. Who wants to go first?
Go for it.
Okay,
Yeah.
you said you can use Crisco.
Yes.
So our industry has said do not use Crisco or coconut oil as lubricants or vaginal moisturizers, because they can go rancid and hold bacteria in your vagina. So what is
if
the
it's-
counter?
If it's rancid, don't use it.
No, it can become, when you put it in,
Yeah.
if it's not completely cleaned out, it can become.
Right. So
Because it can
here's
be
the
held in
scoop
the
on
folders and
Crisco and coconut oil. They're not really studied. Like if you if you search the scientific literature like PubMed and you try and find studies on Crisco, like there are none. So what I'm saying about Crisco really comes from experience. I recommend it to my patients quite often, or coconut oil, and I don't really see people getting infections from it at all. So I don't have the scientific evidence to back it up, but just from experience, I don't really see that at all. Yep.
I wonder if we've done studies on that. Because we have the Patty Brisbane Foundation I told
Yeah.
you about, that we do a
Yeah.
lot of sexuality studies as well,
Mhm.
so.
If you find one, I would love to
Talk
see
to
it.
Patty.
Definitely.
Right.
Tomorrow.
I've
That
searched
was
on
really
PubMed
bad.
for Crisco, it doesn't come up.
Right?
But I didn't call it Crisco, I called it like, what is it, vegetable
Yeah,
shortening.
shortening,
Yeah. Okay.
All right,
Sorry.
so night sweats.
Yes.
Does that, if you are only having night sweats,
Mhm.
is that considered going through?
Oh, yeah.
So I've been having
Yes.
them for years though.
Yes.
And I only get them PMS time. That's
Yeah.
it.
So, okay, so menopause is not like an overnight thing. It usually happens, so basically what happens is like a couple years before that last menstrual period, you'll start having hot flashes, your periods get wacky, your cycle length gets shorter, and then eventually you'll stop having periods, and we don't consider you through the menopause until you've had a whole year with no periods. But those hot flashes and night sweats typically last a couple years after your last period. So it's a bell curve, right? Like most people are like 3 or 4 years before the last period, 3 or 4 years after. But some people, a smaller percentage, are 14 years before and 14 years after. So yeah, so some people are, I know.
That's me.
Sorry. I apologize for that, but some people have hot flashes for a long time
Thank God
after
I've never
their
had
last
hot
period.
flashes, just the night sweats.
So it's the same thing, it just happens at a different time.
Okay.
It's the same mechanism. And you said, I think you mentioned it was cyclic, like it had to do with your
it's
menstrual
PMS
cycle.
without a doubt, yeah.
Yeah, so your hormones are just fluctuating. So that's the point in time when your estrogen's really, really low. And low estrogen or estrogen withdrawal, if you saw estrogen before your body did, and then you take it away, that's when you get hot flashes or night sweats. So interesting thing, so women who have never had any estrogen, so like if your ovaries didn't develop in the uterus or whatever, they've never had estrogen, they won't ever have a hot flash. But once you give them estrogen and you take it away, now you can create hot flashes or night sweats.
I can tell you one thing that really helped me, and I'm not trying to sell anything here, but we sell a pajama line called Euphoria, and it's woven with bamboo, which is a naturally wicking material. So I've been going through that for 9 years now. So, but I would sleep naked because I'm like, God, I'm so hot, and then it didn't help. So then I started sleeping in my Euphoria, my bamboo pajamas, and it takes the heat off of you because it's wicking, and it actually cools me down. I'm actually cooler wearing that than naked. It's pretty amazing with that bamboo material.
Wicking is good. Wicking material is really good.
Yeah.
My
It's
husband's
amazing.
like, what the hell? You've got the air conditioning on at 65 and the windows open and
Exactly.
it's 30 degrees outside.
Living my body
Thank
for one
goodness
day.
it's 30 degrees outside.
Yeah. So things like that can help external.
What is the average age?
Of menopause? 51.
51?
Mm-hmm. Yep.
Knocking on the door.
There.
So the average age of menopause has stayed stable like over many, many years. Menarche, when you first get your period, keeps getting younger and younger and younger. But when your ovaries run out of eggs to release, the average has stayed 51.
Do you blame it getting younger based on hormones and foods and drinks and things like that?
That and obesity. So fat cells make estrogen, and when you're overweight, you tend to start your period earlier. Yeah, so our average weight has gone up over time.
Well, that's interesting.
Yeah.
100 pounds, right? 100 pounds is the kickoff.
The cutoff
No, the
actually
kickoff
know.
of.
of menarche. Yeah, that's menarche is when you first get your period.
And you have to be at least 100 pounds?
You, between 90 and 110 pounds.
Oh.
Yeah,
Really?
maybe.
To be able to menstruate.
So we were reaching.
We're getting there quicker.
Makes sense.
Interesting.
Yes.
Makes sense.
Anything else?
You did a great job. We learned a lot.
Thank you.
Lots
And
of
thanks
notes.
to everybody on Facebook Live for coming. This is all recorded, so we'll play it again. Thank you all.
Stop.